Have you ever thought that some medical tests might do more harm than good, especially as we age? It's natural to want to stay on top of our health. But for seniors over 70, certain routine checkups can lead to unnecessary stress, false alarms, and even dangerous treatments. In today's video, we'll explore 5 common medical tests that experts say older adults should avoid, or at least think twice about. Some of these may surprise you, especially if you've been told they're part of good prevention. Stick around, because understanding which tests to skip could not only save you money, it could protect your health too. Number 1, the overuse of cardiac stress tests. Cardiac stress tests are often used to detect heart problems. They usually involve walking on a treadmill or being given a drug that makes your heart beat faster, while doctors monitor how your heart responds. Sounds important, right? But here's the truth: if you're over 70 and not experiencing any symptoms like chest pain or shortness of breath, this test might be completely unnecessary, and even harmful. According to leading cardiology guidelines, stress tests in seniors without symptoms are more likely to lead to false positives than meaningful diagnoses. That means the test may show a problem that isn't actually there, or one that would never cause harm, setting off a chain of avoidable and risky procedures. Let's break that down. A false positive might lead to an angiogram, where a tube is threaded through your artery to check your heart. If something suspicious shows up, you could be pushed toward a stent placement or even bypass surgery, all of which carry serious risks in older adults, including stroke, infection, and long recovery times. Worse yet, these procedures don't necessarily extend your life if you didn't have symptoms to begin with. That's why many health experts, including the American College of Cardiology, now recommend against routine stress tests in seniors who feel fine and have no history of heart disease. Here's the bottom line: if you're not having heart symptoms, getting a stress test, just to be sure, can lead you down a risky road you never needed to travel. Instead, focus on managing your blood pressure, staying active, and eating heart-healthy foods. These have a far greater impact on your long-term heart health than any treadmill test ever could. And of course, if you do start experiencing real symptoms, like chest discomfort, shortness of breath, or unusual fatigue, that's the time to consult your doctor. But don't let fear or routine lead you into a test that may cause more worry than wellness. Number 2, the colonoscopy trap after 70. Colonoscopy is often promoted as a must-have for everyone over 50. And yes, for people in their 50s and 60s, especially those with risk factors, colonoscopy can be life-saving. But here's the catch: after the age of 70, the story starts to change, and many seniors aren't told the full picture. The risks of the procedure itself increase with age. Colonoscopy involves sedation, which can trigger confusion or even temporary memory loss in older adults, a condition known as postoperative delirium. For seniors with underlying cognitive decline, even mild sedation can have lasting impacts. Then there's the physical risk. The colon is more fragile in older adults. That means there's a higher chance of complications such as perforation, a tear in the colon wall; bleeding, especially if polyps are removed; infections, or hospitalizations due to dehydration or electrolyte imbalances. And here's the kicker: if you've already had 1 or 2 normal colonoscopies earlier in life, your risk of developing colorectal cancer drops significantly. For many seniors over 70, especially those with no family history and no digestive symptoms, the benefit of doing another colonoscopy is very small. On the other hand, the psychological and physical stress of preparing for the exam, undergoing the procedure, and possibly dealing with follow-up interventions can be very real. So why do so many older adults keep getting colonoscopies? Sometimes it's due to outdated screening habits. Other times, it's pressure from private clinics, or even automated reminders in the healthcare system. But guidelines from respected institutions, like the American College of Physicians, say that routine screening colonoscopies after 75 are usually unnecessary, and in some cases, should be avoided entirely. If you're over 70 and your doctor suggests another colonoscopy, don't be afraid to ask questions. Do I really need this? What are the chances it will find something dangerous? What are the risks for someone my age? Being informed could spare you a procedure that may not help, and might even harm. Number 3, PSA tests for prostate cancer. Next up, the PSA test, a simple blood test that checks for signs of prostate cancer. It sounds harmless, right? But for men over 70, especially those without symptoms, this test can be a dangerous trap. Here's why: most prostate cancers grow very slowly. Many older men have small, low-risk tumors that will never spread, never cause pain, and never shorten life. In fact, autopsy studies have shown that a significant number of men die with prostate cancer, not because of it. But a high PSA level can trigger a stressful chain reaction. Multiple follow-up blood tests. A prostate biopsy, which is invasive and uncomfortable. And possibly surgery, radiation, or hormone therapy. These treatments can bring side effects that seriously reduce quality of life, including urinary incontinence, erectile dysfunction, bowel issues, emotional stress and anxiety. And the worst part? Many of these treatments may not have been needed at all. That's why major health organizations, including the U.S. Preventive Services Task Force and the American Urological Association, recommend against routine PSA screening for men over 70, especially those in generally good health with no symptoms. So what should you do instead? If you're not having trouble urinating, and you don't have a strong family history of prostate cancer, most experts say it's better to watch and wait rather than screen aggressively. But if you are concerned about your prostate health, talk to your doctor. A simple conversation can help you weigh the pros and cons, and avoid unnecessary worry or treatment. Remember, not every test equals protection. Sometimes, knowing less is actually safer. Number 4, the full body scan mistake. Imagine this: you walk into a private clinic, pay a few $100s, lie down in a sleek machine, and get scanned from head to toe, just to make sure everything's fine. Sounds like peace of mind, right? But here's the truth: full body scans for healthy seniors with no symptoms are not just unnecessary, they can be dangerous. These scans are often heavily marketed to older adults as a way to catch hidden diseases early. They typically use CT or MRI technology to scan major organs in a single session. But while it sounds advanced and reassuring, medical experts strongly advise against them. Why? Because these scans often detect incidental findings, harmless abnormalities that have no impact on your health. Things like benign cysts, minor calcifications, or tiny nodules that are completely normal for your age. But once these show up on a report, they trigger a domino effect. More scans. Biopsies. Invasive follow-ups. Anxiety and fear. All because of something that never needed attention in the first place. This phenomenon is called overdiagnosis, and it's one of the biggest hidden dangers in modern healthcare, especially in preventive screenings for seniors. And let's not forget the radiation exposure. A full-body CT scan exposes you to significantly more radiation than a regular X-ray, increasing your long-term risk of cancer, particularly if repeated over time. Leading institutions like the American College of Radiology and the Food and Drug Administration, FDA, have issued warnings about these types of scans for general screening, especially for older adults. They emphasize that these scans should only be used when there are real symptoms or specific medical concerns, not as part of a wellness checkup. Here's what you need to remember. Brain: just because we can scan everything, doesn't mean we should. If you're feeling healthy and have no signs of serious illness, full-body scans won't protect you. They may just open the door to unnecessary treatments and stress. Instead, focus on real prevention. Eat well. Stay active. Keep up with essential, evidence-based screenings. And most importantly, talk with your doctor about what's truly worth checking, and what's better left alone. Number 5. Routine imaging for lower back pain. Lower back pain is one of the most common complaints among seniors, and it's no surprise. As we age, our joints, muscles, and discs naturally wear down. But here's what may surprise you: getting an X-ray or MRI for back pain too early can actually make things worse, not better. Many older adults expect, or are even told, that the first step in treating back pain is imaging. After all, if something hurts, we want to see what's going on inside, right? But here's the catch: most age-related changes in the spine look abnormal on a scan, even when they aren't causing pain. In fact, studies show that a huge number of people over 60 have herniated discs, arthritis, or spinal narrowing on MRI, but no pain at all. So when a scan is done for mild or moderate back pain, doctors might find things that aren't actually the cause of the problem. What happens next? You may be referred to a specialist. You may be offered injections, surgeries, or medications you don't need. And all of this comes with cost, stress, and possible side effects. This is why the American College of Physicians and other expert groups now recommend avoiding routine imaging for lower back pain unless there are clear warning signs, such as loss of bladder or bowel control, weakness in the legs, history of cancer, severe trauma. If those red flags aren't present, the best first step is conservative treatment. Physical therapy, stretching and strengthening exercises, heat or cold therapy, gentle movement, not bed rest. And here's the good news: most cases of lower back pain improve within a few weeks without needing any scans at all. So the next time your back flares up, resist the urge to jump into the MRI machine. It's not about ignoring pain, it's about choosing the right path forward, based on what actually helps recovery, not just what shows up on a screen. Remember, treat the patient, not the picture. Conclusion. As we get older, it's natural to want to stay on top of our health, and sometimes that means saying yes to tests and checkups. But as you've seen in this video, not every test is helpful, and some can actually do more harm than good. Whether it's a stress test, a colonoscopy, a PSA check, a full-body scan, or an MRI for back pain, it's important to ask the right questions. Do I really need this test? What are the risks and benefits for someone my age? Will the results actually change my treatment or improve my life? Doctors are there to help, but the healthcare system doesn't always pause to consider whether a test is truly necessary, especially for seniors over 70. Being informed means being empowered. You don't need to refuse everything, just be willing to have the conversation. In many cases, doing less is actually doing smarter. So stay active, eat well, get regular checkups, and when it comes to testing, choose wisely. If you found this video helpful, don't forget to like, subscribe, and share it with someone you care about. Let's spread awareness and help more seniors live healthier, stress-free lives. Thanks for watching, and see you in the next video.